Good day to everyone and to Doctor. My name is Valerie Tong. My matric number is VM24110060, and I am a first-year medical student of batch 2024-2025. In this video, I'll be sharing my findings about the cardiovascular system. The cardiovascular system, or the circulatory system, is a network of organs and blood vessels that transports nutrients such as oxygen and waste products such as carbon dioxide to and from cells. The cardiovascular system consists of three components: the heart, blood vessels, and blood. It is one of the most important systems in the body, and it starts to develop at the end of week 3 after fertilization, with the heart starting to beat at week 4. It interacts with the mother's circulation for the survival of the fetus. The cardiovascular system is also important to maintain homeostasis, such as regulating body temperature, the pH of blood, and it is involved in the transportation of hormones. In this presentation, I'll be focusing on the heart. I'll be talking about the position and anatomy of the heart, the physiology of the heart, congenital heart defects, its treatment, and a renowned cardiac surgeon. The heart is one of the most important organs in the body and is about the size of a clenched fist. Its main function is to pump blood throughout the body. It is well protected by its surrounding structures, with it sitting between the right and left lungs above the diaphragm and is enclosed in the rib cage. The superior border of the heart lies on the line joining the second left and third right costal cartilage 2 cm from the sternum edge. The right border lies on the line joining the third to sixth costal cartilage 2 cm from the sternum edge. The inferior border lies on the line joining the sixth right costal cartilage and fifth left intercostal space in the mid-clavicular line, and the left border lies on the line joining the fifth left intercostal space in the mid-clavicular line and second left costal cartilage 2 cm from the sternum edge. Cardiac muscle fibers are arranged in a spiral manner to enable efficient pumping and directing of blood in the heart. When cardiac muscle fibers in the ventricles contract, the diameter of the ventricles reduces and the apex of the heart is pulled upwards. The cardiac muscle fibers are also interconnected by intercalated discs, which include gap junction and desmosomes. The desmosomes attach and join two cells together, while the gap junction enables the transfer of electrical impulses, ensuring that the heart contracts in unison. The heart consists of 4 chambers: the right atrium, right ventricle, left atrium, and left ventricle. It can be divided into 2 sides, the right and left side, with the right side containing deoxygenated blood, while the left side contains oxygenated blood. It can also be divided into atria and ventricles. The atria would receive blood returning to the heart and pumping it to the ventricles, while the ventricles pumps blood away from the heart. The two halves of the heart are separated by a septum to prevent the mixture of oxygenated and deoxygenated blood. The right atrium is attached to the superior and inferior vena cava. The right ventricle is attached to the pulmonary artery. The left atrium is attached to 4 pulmonary veins which are located on the posterior side of the heart, and the left ventricle is attached to the aorta. The heart also consists of valves that prevent the backflow of blood under high pressure. Atrioventricular valves are valves between the atria and the ventricles. Tricuspid valves lies on the right side, while the bicuspid valve lies on the left side. The leaflets facing the ventricles are attached to chordae tendineae, which are anchored to the trabecular carneae by papillary muscles. They help prevent the eversion of leaflets under high pressure when blood is pushing up against the valves. On the other hand, semilunar valves include pulmonary valves and aortic valves that lie between the ventricles and the pulmonary artery or aorta. The semilunar valves have cuffs that fill up with blood and force the leaflets to meet in the middle when blood is trying to flow back into the ventricles. Humans have a closed double circulatory system. This means that the blood flows in closed blood vessels so that the blood is never in direct contact with the tissues. Nutrients and waste products are transported across cell membranes of the blood capillaries and target cells. In a double circulatory system, blood flows through the heart twice for two separate circuits, the pulmonary circuit and the systemic circuit. The pulmonary circuit brings deoxygenated blood away from the right ventricle through the pulmonary artery, and the blood travels through the pulmonary artery and blood capillaries to the lungs to undergo gaseous exchange. Oxygenated blood then travels through the blood capillaries and pulmonary vein back to the left atrium of the heart. On the other hand, the systemic circuit brings oxygenated blood from the left ventricle to body tissues through the aorta, arteries, and blood capillaries. Deoxygenated blood is then transported back to the right atrium through the blood capillaries, veins, and superior or inferior vena cava. An atrial septal defect, or ASD, is an opening in the interatrial septum. ASDs can be caused by patent foramen oval, foramen secundum defect, or foramen primum defect. In a healthy infant, the foramen oval should close up when oxygenation in the lungs leads to higher pressure in the left ventricle to push septum primum against septum secundum. Problems arise when there is shunting or mixing of oxygenated and deoxygenated blood. Not only that, large ASDs can lead to the overfilling of blood in the right atrium and sending too much blood to the lungs, causing the right side of the heart to work too much. This leads to pulmonary artery hypertension, elevated pulmonary vascular resistance, and right ventricular hypertrophy by the time people are in their 30s or 40s. Some small ASDs close spontaneously during the first few years of life, but long-term untreated ASDs can lead to complications after 20 years of age. Adults and rarely adolescents may present with exercise intolerance, dyspnea, fatigue, and atrial arrhythmias. ASDs can be diagnosed when there is a soft systolic murmur at the upper left sternal border with wide and fixed splitting of the second heart sound. It can also be diagnosed by using echocardiography. Treatment of ASD includes observation, transcatheter closure, or surgical repair. Most small, less than 3 mm centrally located ASDs close spontaneously, while many ASD between 3 mm to 8 mm close spontaneously by the age of 3. Asymptomatic children with small shunt require only observation and occasional echocardiography. Although these children are theoretically at risk of paradoxical systemic embolization, this event is rare in childhood. Moderate to large ASDs should be closed at the ages of 2 to 6 with transcatheter closure. This procedure should consider appropriate anatomic characteristics such as adequate rims of septal tissue and distance from vital structures such as aortic root and pulmonary veins. Surgical repair is only necessary when their anatomical characteristics are unsuitable for transcatheter closure. A cardiac surgeon is a medical doctor who performs surgeries on the heart and the blood vessels connected to it. Their primary role is to treat conditions affecting the heart and its surrounding structures. The cardiac surgeon I've chosen to talk about is Tan Sri Dr. Yaya Awang. He is known for performing 2 coronary artery bypasses on the former Prime Minister Tun Dr. Mahathir Mohamad in 1998, 1989, and 2007. He also successfully performed the country's first ever heart transplant operation in 1998. Dr. Yaya came from a family of doctors, and he chose to become a cardiac surgeon in Malaysia after pursuing his studies abroad. In the 1970s, Dr. Yaya was a cardiac surgeon working in a government hospital with just 5 beds for heart patients. He saw that the hospital had to turn away patients, many of them who come from the kampong, because there was not enough space to help them or because they had come too late. With this, he established the National Heart Institute, or Institute Jantung Malaysia, in 1992 to provide more access to cardiac health. Today, Institute Jantung Negara is one of the largest hospitals in Malaysia dedicated to the diagnosis and treatment of cardiovascular and thoracic diseases. Dr. Yaya is truly an inspiration, especially to us medical students, for he is not only skilled, but he is passionate about helping his people. That's all from me. Thank you.